So in the cancer patient, the fertility potential is dependent on a number of factors. The kind of cancer therapy the man has had, prior paternity. Has he ever got anyone pregnant before? His ejaculation history. Does he ejaculate? Is he a 14-year-old boy who's never ejaculated? Does he have nocturnal emissions? When young boys come to see me before they're getting chemotherapy and we're talking about their fertility potential, we'll always ask them this question. Tanner stage refers to the stage at which the man or boy is in the development of puberty, and there are 5 stages of that. Testicular volume and consistency is very important, and serum FSH level is important. Remember I told you that the testes produce sperm. The size of the testes is a very rough surrogate for the ability of that organ to produce sperm. I already showed you the diagram where FSH goes from the pituitary gland all the way down to the testicle. There is a negative feedback system, and that system works as follows. When there's good sperm production, there's a hormone that goes from the testicle down all the way back up to the pituitary gland, and that hormone is called inhibin, I-N-H-I-B-I-N, inhibin. And inhibin tells the pituitary gland, we've got enough FSH. We don't need any more. And so the FSH level in men who have normal sperm production is very low. Usually it's less than 4 to 6 international units per ml. When the sperm production is not normal, then there's less inhibin produced, and the pituitary gland makes more FSH. And so the higher the FSH, the less sperm production there is. And so men who even have FSH levels in the high normal range, but on the high end of that, may in fact have impaired spermatogenesis, impaired sperm production. So this is a diagrammatic representation of a small testicle on the left and a normally sized testicle on the right. And if these were adult testes, we would say that the man on the left will have, even without having a semen analysis performed, I will tell him that he will likely have abnormal sperm production because of the size of his testes. What is the standard laboratory assessment of the man who comes in for fertility evaluation? Well, it's very basic. First of all, there is hormone blood tests, which checks his follicle stimulating hormone level, FSH, and his testosterone level, as these are the 2 hormones that are involved in sperm production. We will encourage him to get at least 2 semen analyses separated by 2 to 4 weeks. Let's talk about a semen analysis for a second. If you're a man who's looking at this video and you have not yet done a semen analysis, this is how you should do it. Ideally, you should take 2 to 3 days off without ejaculation. You need to allow semen and sperm production to build up, but we don't want you waiting much longer than 4 to 5 days because as sperm get older, their motility level drops. Under ideal circumstances, you will produce a specimen at the sperm bank or at the fertility center, so you do not have to transport it from your home to the sperm bank. And they're the very basics with regard to sperm semen analysis, and we'll talk a little bit about sperm banking in a few minutes. There are many advanced sperm techniques that are done, sperm chromatin assay, karyotyping, that are beyond the scope of the discussion tonight. But needless to say, there will be some of you who will look at this video who will in fact need to undergo further genetic testing. I put this complicated slide up here, and I want you to focus your attention on the left-hand column. The left-hand column that says exogenous testosterone, and on the left-hand side you'll see T for testosterone, LH, FSH, and prolactin. And if you are taking anabolic steroids, including testosterone, you'll see that the T level, testosterone level, is high, but the LH level and the FSH level are suppressed. When men are on exogenous testosterone, with time, there is shrinkage of the testes, testicular atrophy, and there is also suppression of FSH, which will cause absence of sperm production. Now, in some men, with time, if they're on the anabolic steroid long enough, then the sperm production will stay 0 and will be irreversibly lost. So, testosterone should not be prescribed to men who are interested in future fertility, and anabolic steroids are a very common cause of permanent testicular damage. So a semen analysis looks at many different things. The 3 most important things are sperm concentration, sperm motility, and sperm morphology. This is the normal semen sample. Now, it's surprising to most men that most of the semen is not sperm. In fact, only about 5 to 10% of semen is sperm, and that comes from the vas deferens. The vast majority of the fluid in semen comes from the seminal vesicle, and it's supplemented by the prostate. And these contain chemicals and nutrients that are very important for the survival of sperm inside the vagina. The normal volume of semen is about 1.5 to 5 mLs. Remember, 5 mLs is a teaspoon. So we're producing far less ejaculate volume than we think we are. The pH should be alkaline, and the concentration of sperm should be above 20 million per ml. In fact, if you look at normal men, men with normal fertility, the average sperm concentration is 60 million per ml or greater. Levels below 20 million per ml constitute oligospermia and indicate abnormal sperm production. Motility should be above 50%. That is, 1 and 2 sperm should be swimming in a forward direction, in a linear direction. Levels below this is asthenospermia. There should be, according to the World Health Organization, more than 30% of sperm that look normal under the microscope, and below that is teratospermia. And there are medical conditions that are associated with decreased sperm motility and decreased normal morphology rates. So what about the inability to give a semen sample? Sometimes it's due to anxiety. There are men who go to a sperm bank or a fertility center who are given a cup, sent to the room, and are unable to produce because of anxiety. There are some men who have pain or disability from cancers in the pelvis that preclude them from giving a semen sample. Young age, cultural and religious reasons, and some men have psychogenic anejaculation. They have never been able to ejaculate because of psychological reasons, and these men, of course, are unable to give a semen sample.